Would it surprise you if I told you that each and every one of you could save up to 18 lives every year? Well, this statement is true. Few people think about blood until they're at a hospital in an emergency and learn that the only thing that can save their child, husband, or themselves from death is a transfusion of blood. Tonight I'm going to try and persuade you to become a blood donor. You may be asking me why I'm trying to persuade you to donate blood. Did you know that someone needs a blood transfusion every 2 to 3 seconds, and 95% of all Americans will need a blood transfusion in our lives? That means that you, your family, and your friends would need the support of volunteer blood donors. This is why today I urge you to go out and donate blood. I know some of you may hate the thought of needles or think giving blood won't really help, but please consider what I say and make a better informed decision after hearing the benefits I present in this speech. Here are some facts about the blood supply, the needs, and the donors. Approximately 36,000 units of red blood cells are needed every day in the U.S. The average red blood cell transfusion is approximately 3 pints. The blood type most often requested by hospitals is type O. Only 9% of people in the U.S. have type O negative blood. Type O negative donors are universal red cell donors and can be given to people of all blood types. A single car accident victim can require as many as 100 pints of blood. The number of whole blood and red blood cell units collected in the U.S. in this year was 13.6 million. Although an estimated 38% of the U.S. population is eligible to donate blood at any given time, less than 10% of them actually do each year. So let's begin with the need for the donation of blood. Transfusion of red blood cells, platelets, and plasma are critical to a patient's return to good health and vital in helping to save someone's life in an emergency situation. Some individuals requiring blood are surgical patients, burn victims, accident victims, seriously ill babies, and people suffering from leukemia, cancer, kidney disease, and liver disease. It is estimated that in the United States, every 3 seconds a patient needs blood. That's a lot of blood. Sometimes the blood can be pre-donated by the patient themselves. However, most of the blood needs to come from healthy volunteer donors. Yet only 10% of the eligible U.S. population donates blood in any given year. The demand for blood never lets up because every day thousands of people need donations to survive. The blood must go through a series of time-consuming tests and then used before it perishes. Whole blood, for instance, cannot be used after 42 days. As a result, maintaining an adequate blood supply is a challenge. Healthy donors are the only source of blood, as blood can't be made or harvested, so there is no substitute. The blood supply in the U.S. is consistently low, and the demand for blood increases each year, much faster than the rate at which people are donating. To put this into context, currently more than 4,000 gallons of red blood cells are used in the U.S. every day, and that amount is increasing. As I said earlier, it is estimated that 95% of us will need a transfusion at some point in our lives. So by donating blood to ensure that there is enough in supply, the life we save may be our own. Although all blood is made of the same basic elements, not all blood is alike. In fact, there are 8 different common blood types, which are determined by the absence or presence of certain antigens. Antigens are just substances that can trigger an immune response in the body. So some of these antigens can trigger a patient's immune response, so the system is attacked with a transfused blood. And safe blood transfusions depend on careful blood typing and cross-matching. There are 4 major blood groups determined by the presence or absence of 2 antigens, A and B, and those are found on the surface of red blood cells. Group A has only A antigens on the red cells. Group B has only B antigens on the cells. Group AB has both A and B antigens, and Group O has neither A or B on the cells. There are very specific ways in which blood types must be matched for a safe transfusion. In addition to the A and B antigens, there is a third antigen called the Rh factor, which can be either present or absent. In short, Rh negative blood is given to Rh negative patients, whereas Rh positive blood or Rh negative blood can be given to an Rh positive patient. The universal red cell donor has type O negative blood, and the universal recipient has an AB positive blood type. Now that we know the problem, let's move on to the solution. I'm hoping most of you by now are considering giving blood, and I'm sure most of you are wondering what it entails. Well, giving blood is an incredibly easy 4-step process, which includes a registration, a medical history mini physical, donation, and then refreshments. Anyone who is at least 17 years of age, or 16 with a parent or guardian consent in certain states, and who weighs at least 110 pounds and is in good health can donate. If you think you could be eligible to donate, visit one of the many blood mobiles around your community. Here you will answer a list of questions relating to your medical history. If you pass the medical history test, and if your iron levels, blood pressure, temperature, and pulse are at an appropriate level, you may donate blood. The donation process, from the time you arrive until the time you leave, is about an hour. A blood technician will clean your skin around the vein in your arm and then insert a sterile needle to extract the blood. The donation itself is only about 10 minutes. For most, about 1 pint is taken during the donation. The fluid content is replaced naturally by the body within 24 hours, and the red blood cells that are lost are replaced within 10 days. You must wait at least 8 weeks or 56 days between donations of whole blood and 16 weeks between double red cell donations. But as you can see, it's safe, simple, and most importantly, it can save up to 3 lives. So finally, let's talk about the benefits of donating blood. Donating blood is good for the health of the donors as well as those who need it. One way in which donating is beneficial is that it can uncover potential health problems. Donating blood can be another way to keep an eye on your cardiovascular health. You'll receive a mini physical prior to the blood draw and that can sometimes shed light on the issues you didn't even know about. If your blood is too low in iron, the clinic will tell you and they won't draw your blood. They will also inform you of any other blood issues they notice or if something seems unusual. It can reduce harmful iron stores. 1 in every 200 people in the U.S. is affected by a condition called hemochromatosis, and most don't even know it. This is a disease that causes an iron overload and is labeled as the most common genetic disease among Caucasians. Donation is a way to reduce the body's extra iron stores, with the removal of red blood cells being the preferred treatment for patients with excess iron in their blood. A third benefit is reducing the risk of suffering from a heart attack. Donating blood at least once a year could reduce your risk of having a heart attack by 88%, according to a study conducted by the American Journal of Epidemiology. This again relates to the iron issue. High levels of iron in the blood constrict your blood vessels and create more risk of a heart attack. Depleting the extra iron deposits gives your vessels more room to operate. Lastly, it gives you a sense of significance. While there are several physical benefits to donating blood, the most powerful benefit is arguably in the psychological realm. Donating blood means that someone, or multiple people, somewhere will be getting the help they desperately need. So in conclusion, the process of donating blood is simple and takes only a few minutes of your time, but the impact it makes when people donate is significant. The blood you give saves many lives, because people involved in road accidents, people having surgery, patients with cancer, and women having babies are all saved when you donate. The demand for blood is always increasing, and when you donate blood, you will assist in meeting the demand. The need for blood is always increasing on a daily basis because patients who require blood walk into hospitals daily, and with your donation, there is a guarantee that a life will be saved. If my speech has persuaded you to donate blood, then please visit our local American Red Cross on Maple Street in Hornell and join the millions of people who are graciously donating their blood to those in need.
Good job.